right, so we're going to wrap up chapter 27 by talking about blood pressure. So in the ATI book, they list the different blood pressure classifications, like what's pre-hypertension, what's stage 1, what's stage 2. I would definitely be aware that the American Heart Association has released new guidelines which are different than these. But since you're taking an ATI test, likely they'll be asking you questions based on the guidelines in the book. So that's what I'm going to talk about now. So normal blood pressure is where systolic blood pressure is under 120 and diastolic blood pressure is under 80. Prehypertension is where systolic is between 120 and 139, or diastolic is between 80 and 89. Stage 1 hypertension is where systolic is between 140 and 159, or diastolic is between 90 and 99. Stage 2 hypertension is where systolic is over 160 or diastolic is over 100. Hypotension, a patient is considered to have hypotension if their systolic blood pressure is under 90. So in terms of diagnosing someone with hypertension, we want to take their blood pressure readings on 3 separate occasions over a number of weeks. So this isn't taking it 3 different times on the same day. This is taking it once on one day, taking it another time maybe a few days later, taking it again like a week later. 3 separate readings over a couple weeks would be indicative of hypertension if it's elevated at all 3 of those visits. Now let's talk about orthostatic hypotension. So orthostatic hypotension is when a patient sits up or stands up and their blood pressure plummets. These patients are at super high risk for falls, so it's really important for you to know whether your patient has orthostatic hypotension or not. So let's talk about how we determine if a patient has orthostatic hypotension. So you're going to take your patient's blood pressure when they're laying flat, so they're supine. Then you're going to have them sit up, and you're going to wait a couple minutes, like 2 to 3 minutes, and then take their blood pressure again. And then you're going to have them stand up and wait a couple minutes, and then take it again with them standing. And if their systolic blood pressure decreases 20 mmHg or more when changing position, or if their diastolic blood pressure decreases 10 mmHg or more with a 10 to 20% increase in heart rate, this is indicative of orthostatic hypotension. So I would definitely know that criteria. And then in terms of nursing care, if your patient is positive for orthostatic hypotension, you definitely want to assist with ambulation, and you want to advise your patient to sit on the edge of the bed and slowly rise. So they shouldn't just like pop out of bed. They need to sit on the side of bed, give it a couple minutes, and then slowly get up. And they should always just change positions slowly. Now let's talk about some important things to know about blood pressure. So I would know that pulse pressure is systolic blood pressure minus diastolic blood pressure. The reason why we want to know the pulse pressure is if it is elevated, this can indicate an increased risk of cardiovascular disease for the patient. I would also be familiar with the proper sizing of a blood pressure cuff, and ATI does like to ask questions about BP cuffs. So the cuff width should be 40% of the arm circumference, and the bladder should surround 80% of the arm circumference. If you have a cuff that is too large, you will get a falsely low reading, versus if you have a cuff that is too small, you will get a falsely high reading. Some other important things to know when taking blood pressure. You never want to take blood pressure in an arm where there's an IV infusion running. You also do not want to take BP on the side where a patient has had a mastectomy, or if a patient has an AV shunt or fistula on that side, you don't want to take blood pressure on that side. To estimate systolic blood pressure using the auscultatory method, you want to palpate the radial pulse and inflate the cuff until the pulse disappears. Then you should inflate the cuff another 30 mmHg, and then release pressure and note when the pulse is palpable again. So that is it with this chapter, and we'll pick it up with the next chapter in my next video. Thanks for watching.